Hey, it's time to talk with a good friend of ours, Dr. Josiah Fitzsimmons from Vero Neuropathy, board certified in neuropathy. Dr. J, how are you, my friend?
Lou, I'm doing awesome. How are you doing?
We are doing great, and we're hopefully going to give people some information so they can start feeling great. We're talking about neuropathy, and in the past, you've been on the program. We talked about people who take some medicine to try to relieve some neuropathy pain. Now, neuropathy pain is pretty severe, and just wondering if some of this medication might be contributing to the prescription drug problem that we're experiencing now, because are some of these opioids, what's the deal with those?
Absolutely common question. Most of the drugs prescribed for neuropathy are in their own drug class, such as gabapentin, Lyrica, Cymbalta. But most of these drugs are actually created for other conditions, such as seizures, fibromyalgia, shingles, even depression medications. But they're prescribing them off-label for neuropathy because they don't have any other options. They're just kind of throwing the kitchen sink at people because they don't know what to do. So misuse definitely can become problematic. They're not officially opioids, but people definitely can become physically dependent on them.
So why are they being prescribed these drugs on such a large scale?
Well, do show a little bit of relief with neuropathy, but they really don't do anything for you long term. Some people, they help them function day to day, but they're not doing anything to actually correct the condition.
Okay, there's a lot of people that are watching this program now that might be treating their neuropathy with these drugs, and they might be thinking to themselves right now, I don't really need to have a problem with this. Is there something we can do about this?
Great question. If they're taking the drugs, definitely talk to the doctor, express their concerns. Ideally, they can gradually get off of the medications while they actually get the root cause corrected. And that's really the goal of our clinic.
Okay. Now, what other treatments can be done? Because you can't just wean yourself off of the drugs and then not do anything and hope it gets better.
Absolutely. So the best course of action is to get full evaluation to determine the underlying cause of their symptoms. With neuropathy, most people are experiencing tingling in the feet, legs or hands, burning pain, muscle weakness, maybe sensitivity or electric-like pain, numbness. That can affect coordination, balance, really affects a lot of the day-to-day life. And we actually treat those nerves directly. We have an awesome testimonial of one of our patients, Kay, who was waking up 3 to 4 times a night with pain from neuropathy.
Problem I presented with was difficulty sleeping. Neuropathy would wake me up 2 or 3 times every single night. Now I can count probably twice in the last several months where that's happened. So that's significantly improved. So that was the primary reason. All the others I consider kind of added benefits. But I can stand a little bit longer, and I could walk a little bit taller, a little bit stronger, I guess I would say. But definitely sleep better. And a couple other things, I have really, really high energy level anyway, and it's even increased my energy, and I can't even believe I'm saying that, but I just feel like I have a more positive outlook for the future of my health.
A more positive outlook for the future. Well, how about that? Is that great? Now, are all neuropathy treatments the same, or are yours a little bit different?
At Vero Neuropathy, we do a complete evaluation and analysis of the nerves. We actually calculate down to the exact percentage, what percentage of nerve loss people have. We don't do any cookie cutter, one size fits all treatments. We actually use state-of-the-art FDA-approved technology that actually helps regenerate the arteries and restore the nerves. We don't use any drugs, no injections, no surgery. Our goal is to actually correct the cause of the issue.
All right, we need to get to the cause of the issue, and you have a special that's going on right now. We urge people to take advantage of it. Tell us about your special.
Absolutely. When you come in our office, we'll do a full consultation, a full sensory exam, where we'll calculate, like I said, down the exact percentage, how much loss you have in your hands or your feet. And then we'll go through all the findings. We'll lay out a personalized game plan for each individual.
All right, and it's $49, and this is normally about $250, folks, just so you know. So for $49, you get that complete evaluation that he just talked about. 755 pain, 755 pain, or you can text the word painless to 21,000. Text painless to 21,000. You get a return message, or 755 pain. It's a 515 area code, of course. Dr. J, great information, especially if there are some people out there suffering from neuropathy who have been taking medication for a while. There's a way to get off of it and do yourself some favors and treat that pain the proper way too, and get some relief in short order, right?
Absolutely. You don't have to continue living with the pain that you're in. So many people have given up hope, but they don't have to. We'd love to help them.
All right. Dr. Josiah Fitzsimmons from Vero Neuropathy, thank you so much for your time, and we will talk to you next time.
Sounds great.